I'd like to welcome everyone to the AI4PEP lecture series. And this has been uh, a very important event that we've been holding as a network. And a lot of the previous participants have attested to how exciting and informative and insightful that this lecture series have been. I'm going to hand over to Taylor, our communications coordinator, who is going to be introducing the speaker. We have a special guest who will be speaking to us today. So over to you, Taylor.
Hi, good morning, everyone, or good evening, depending on where you are. My name is Taylor, and I am the communications coordinator at AI4PEP. Welcome again to our lecture series for today in real life. Our topic will be Advancing Healthcare with Machine Learning, Applications and Case Study. And our speaker today is joining us in affiliation with Sunway University in Malaysia as part of our AI4PEP Malaysia team. So before we get into it, a quick summary of AI4PEP if you're not familiar with us. AI4PEP is a global research network connecting over 15 countries in the global south around a shared goal of leveraging responsible AI solutions to strengthen equitable healthcare systems and power inclusive Southern-led research. So I put a QR code on the screen here. If you're not familiar with us and would like to connect, please feel free to scan that or reach out to us on our socials or on the website or LinkedIn. Okay, so into our agenda. We're spending about 5 minutes on the introduction and welcome, and then we'll move into our lecture by Dr. Samuel Soma, who will introduce in a moment. Then we'll have a brief quiz on the topic that he shares right afterwards, and we'll move into a Q&A period where the audience can ask any question we want to our speaker, and then we'll have a quick closing remark. All right, so on to introducing our amazing speaker, Dr. Samuel Soma Ajibade. So Dr. Samuel Soma Ajibade is a computer science expert with 11 years of teaching and research experience spanning 4 continents, Africa, Asia, South America, and Europe. He is currently an assistant professor at Istanbul Ticaret University in Turkey in their Department of Computer Science and Engineering, and at Sunway University in Malaysia in the Department of Computing and Information Systems. He's also an adjunct associate professor at Miva University in Nigeria and a visiting researcher at INTI International University in Malaysia. So he's international. As an educator, his expertise encompasses diverse topics in AI and machine learning, which we will hear about today, as well as data analytics, information systems, and other technologies. Dr. Ajibade is also an active researcher on the AI4PEP Malaysia team, and his research interests are rooted in leveraging machine learning and AI to address global challenges, enhance healthcare systems, and drive sustainable development. He's dedicated to empowering his students to excel while also contributing to the computer science field in ways that have a positive global impact. So Dr. Ajibade, the floor is yours.
Thank you so much, Telakagil, for that introduction. All right, and thank you for having me, everyone. I'm so excited to be here, and it's really my pleasure to be here. Once again, my name is Samuel, and I will be talking on the topic advancing healthcare with machine learning. So considering applications of machine learning on healthcare and a case study. Yeah, so I'm going to be presenting on the topic advancing healthcare with machine learning applications and case study. Okay, and my name again is Samuel Ajibade, and that's my profile. Yeah, my Google Scholar and LinkedIn link. Okay, so now introducing us to machine learning in healthcare, because now I have to actually work with time. Yep. Now, machine learning in healthcare is actually a kind of technology that helps computers to learn, from data, and then they make quite a number of decisions without having to control them. So why do we actually use machine learning? Because we try to make a particular model to train a pattern. So in training that pattern, it learns the pattern, and then it is now able to be applied for some other data. So normally when we're using machine learning for prediction, for example, when there's a prediction actually happens based on historical data. So we have a data, and then we train a model to learn the pattern on that data, and then we now use that same pattern, apply it on another data, or probably on a splitted data, so that now it's more or less automatically it's been applied. So we use machine learning also in healthcare to do quite a number of things. So, and there are different types of machine learning techniques, quite a number. We'll talk about them anyways. So I just mentioned a few ones there. Supervised learning, unsupervised, reinforcement learning. So I'm going to talk about them in details later on. So we have various applications of the machine learning in healthcare. So we use for predictive analytics, we use for medical imaging, we use for personalized medicine, drug discovery, and then so hospital operations. So these are the applications that I'm going to make mention of. I'm going to talk about in other slides. So now, talking about the importance of data in machine learning that is being used for healthcare. So why actually do we need data? We need data especially for decision making. So a lot of times when we work with data, definitely when we're working with machine learning, we're working with data. So, and this data are actually very needed for decision making. And what kind of decision are being made? One, there are decisions that are being made for patients, decisions that are being made even for facilities, decisions that are being made for staff, okay, for the kind of medications that will be administered to patients, and then what kind of things do you need to give to the patients and all of that. So healthcare professionals actually make informed decisions, and machine learning techniques nowadays have made it easier, unlike before where they have to crack their brains. You're performing some scans, and then you really can't know where the problem is coming from. So you have to sit down, analyze graphs, manually. But now it's been done automatically. That is, there's an automated system that handles that. Okay. So again, data is important for personalized treatment plans. A lot of times, there are patients that have some personalized issues, maybe underlying issues, and then they need to prepare personalized treatment plans for them. So that again is another reason why data is needed. And then again, for early disease detection, research and development, and healthcare resources optimization. So I just talked briefly on this because in the upcoming slides we're going to have to talk about them in details. Now, challenges in applying machine learning. There are various challenges that comes with applying machine learning. Even though machine learning has helped to optimize the use of healthcare, but then it comes with its own challenges. For example, we have what we call the data privacy and security. This is a very major challenge because health professionals must know how to keep data of patients safe and secured, such that people cannot hack into them. So, meaning they have to be confidential. They have to practice confidentiality and no breaches of data. So, that is very important. Another is interoperability, which you have to integrate machine learning systems with already existing healthcare infrastructures or healthcare system. Now, this again is a challenge because you have an already made system, existing system. Now you're bringing another model, you're bringing another system to integrate. So a lot of times it could be challenges with the system that you try to integrate. It could be challenges with the personnel, that is the people that will be using it. Some believe that, oh, they are this that we're used to for years. Now bringing something else to integrate is going to give us, challenges, trying to learn the new method, trying to learn. But then these are challenges that are being faced. Another is data quality. when we have incomplete data, when we have inconsistent data, when we have biased data, imbalanced data, it causes a lot of problem, or redundant data. So it's when that data quality is not, or when data is not quality enough, then it doesn't give accurate results. Also, we have regulatory compliance and ethical concerns, which I'm also going to talk about. Yeah. Now, ethical considerations in machine learning for healthcare. There are various ethical considerations that has to be put in place. The data privacy and security, which I mentioned earlier, is one where you have to, as a professional, as a data professional, healthcare professional, you have to ensure that patient data is confidential, because this it's a very big offense when people pass out patients' data without without going through the normal route to do that. If at all it has to be done. Okay. Then bias and fairness. Addressing biases in data set also can lead to discriminatory outcomes. A lot of times when we that work in AI or machine learning field, okay, when we're trying to get data, a lot of time there was always biases in the data. And that is why you need someone that is an expert to be able to clean the data, to be able to perform some data cleaning, some data transformation to make the data suitable for analysis. And so this also is something that has to be considered when we talk about ethical consideration. We have to consider bias and fairness, and auditing algorithms to mitigate bias is very important. Transparency. So now when we talk about transparency and explainability, you as a professional, as a health professional, you have to be able to provide clear explanations of how the machine learning model or reaches its conclusion. Now, that doesn't mean the nurses and the doctors have to understand that, because for nurses and doctors in the hospital, they've been trained to be nurses and doctors. But then they are nowadays there are people we call health analysts. There are jobs that there are people that are being employed as health analysts, not just data analysts, health analysts, financial analysts, So health analysts, a lot of times, or medical analysts, what they do is to implement all of these techniques. A lot of times now, people that I see, a lot of people that have been employed as health analysts, one of the criteria is that they must have knowledge of machine learning, Python specifically. Now I'm talking about programming languages. Maybe people that are a bit familiar with that, Python specifically, or maybe R. Why? Because they're going to be analyzing data. Yes. So medical doctors are not expected to do that. Theirs is just to, okay, see the result and then consult and provide solution. Okay, so transparency and explainability is very important. Now, informed consent and patient autonomy, and then accountability, oversight, all of these things to be taken care of, and equity and access. Okay. Now, what is the role of data in machine learning? I made mention of this earlier on. Okay, I mean, now just talking about the role of data in machine learning. Data collection, healthcare data is collected from various sources. Now, when we're trying to gather data, a lot of times we get it from electronic health records that are already existing on the system. We get it from medical images. We're going to talk about medical images, how machine learning is being used for medical images, for image recognition. Okay, so we have medical images. We have wearable devices that provides also it helps patients as well to be able to communicate. All right, so you can use all those devices also to detect diseases. Okay, and then genetic testing. So the quality of data is very important. The quality and the quantity plays a crucial role, okay, in how the machine learning technique now would have to how the performance of the machine learning technique will come out. That is the outcome. Another thing is data pre-processing. Now, when we collect data, before we can analyze data, we have to collect the data. It's more like you mine the data. For example, when we mine fuel that we put into our cars, it's been mined in the raw states. That is, you have in when it's being collected, you have stones, you have sand, you have different things in its raw state, right? So that way it cannot be used yet. It has to be refined. The oil needs to be refined before it can be transported to a fuel station where we can now buy and put into our cars. So the same thing when we collect data from different sources in its raw states, in its raw format. So now we have to do some data pre-processing, we have to clean, we have to transform, we have to do some, just to make it clean, to make it suitable. So we have to organize it. If you need to change the format, so many things we have to do. And then also we have to perform feature selections. So many of these data come with different features. Then we want to find the most important features. A lot of times when we are extracting features, we want to remove the irrelevant ones, the redundant features that are actually not important. So this is very important because we need our data to be well cleaned. We need it to be well groomed and ready for analysis. Then another thing also, I mean, now I'm talking about the role of data, what data does in machine learning application. Data labeling, which is also important for training our machine learning models, and privacy and security, which I've made mention of a lot. Okay, now what are the types of machine learning algorithms that are being used? We have supervised learning. Okay, so now when we talk about supervised learning, the computer is given, now I want to make a scenario, the computer is given both the inputs and correct answer. For example, we have an image. So the computer has been given an image, a picture, and then that picture now it has a correct answer. Maybe it's classified as a cat, or that picture is classified as a dog, or it's classified as a lion. But then now the computer it trains on identifying that particular picture. So now the picture has been input into the system. So now the computer learns that pattern, that this particular picture, anywhere you see it, it is a cat. It is not a dog. Even though a cat, maybe the face of a cat might look like a dog, but because that model has been trained that when you see this picture, this is a cat, not a dog. So after that time, after it has been trained, now you can decide to deploy to test it to see if what you've trained actually works well. So you input different data now, different pictures. You want to see picture of a dog, picture of a cat, picture of a lion. You want to see if the model now has learned the pattern. I said something at the beginning that when we are actually making use of models, we are prediction rather, when we're performing prediction, we're performing prediction on historical data. So there's a data, for example, weather forecasting. When we want to predict weather, people that the weather forecast is not what do you call it, juju. It's not something. Sorry for people that don't understand. It's not something that we call that is. I'm trying to remember a name that we use for that. It's not something that is charm or something like that, because weather forecast is based on past data. So it's not that they are doing anything out of the ordinary. They are only they've trained some historical data, and then it helps to predict the weather based on the historical data, based on past data. When I mention historical data, I mean past data. Okay, based on past data. So now we are able to predict the weather for the next 4 days. You can predict weather tomorrow. For tomorrow, okay, it's going to rain 10 p.m. tomorrow. Sometimes it's not accurate, maybe 90% accurate. That is why sometimes you will check your weather forecast in the morning, it will tell you 6 p.m. is going to rain, and then it will eventually will not rain. So that doesn't mean it is incorrect. That it is because it is not 100% accurate. It could be 95% accurate, which is okay. Okay, it could be 99% accurate, which is still fine. All right. So supervised learning, now we have to train, you have to learn a particular pattern. Now, on supervised learning, the computer is just giving inputs, and then you have to figure out the pattern. So we give you the input, and then you leave it to figure out the pattern, okay, itself in the unlabeled data. So the data is there, but they are not labeled. All right. For supervised, now the difference between this one and supervised is that for supervised, you have the inputs, you have question, you have answer. All right. So you've been given a question, exam question, you've been given the answer to match. Okay, but then for unsupervised, you've been given only the question. You have to figure out the answer yourself. All right, so that's just a difference, just to make you understand that. And then we have the reinforcement learning. Now, the computer learns through trial and error, getting rewards when it makes the right decision. So now, in reinforcement learning, it's with try and error. You have to try. If this works, okay, it doesn't work, try another one. If it doesn't work, you try another one. So when you make the right decision, you're given a reward. Just like, when you're trying to train a pet. Okay, you're trying to train, you just bought a pet, and then you're trying to train the pet to catch. When you throw something, you catch. Okay, you throw toward this angle, maybe it's a dog. It tries to catch with his mouth. You throw toward this angle, you want it to be able to, you're training the pet to be able to perform some actions. So when the pet does something good, maybe you pat the pet at the back, right? Or maybe when you try to train a kid to do something, okay, you do this, I reward you. For doing this task, I reward you. So that is how the reinforcement learning. Now, we're talking about deep learning. Deep learning utilizes neural network with multiple layers to extract high-level features. So now again, it's still deep learning is a part of artificial intelligence that are being used. Now there are so many models in deep learning that are being used. Okay, now applications of machine learning. I'm just going to run through this because I still have other slides that explains all of this in details. So we use it for predictive analysis of patient diagnosis. That is, we use machine learning to diagnose patients. All right. We use it for image recognition, which is when you're doing medical imaging, for drug discovery, personalized medicine, remote patient monitoring, and then hospital operations. So I'm trying to work with time. All right, so let's talk about this one after the other. Predictive analysis for patient diagnosis. Now, what do we mean by predictive analysis in healthcare? It involves using data, using algorithm. Okay, so just like I mentioned, when we're performing prediction, we're using a machine learning technique to train. Okay, we're training a data, we trained on a data, and then we can now test on it. That is why when we are performing machine learning, when we're using machine learning techniques for data, we always have split data. So you split some into training and testing. So now you train on this particular set of data. Maybe you're doing, it depends, 70-30, 80-20, 60-40. I'm talking about the percentage for training and testing. So you train on this particular data sets, okay, so that it can learn the pattern. Then if you want to now determine the accuracy, you test. You want to test after you've trained over time, then you now test it with the remaining percentage. That way you can see the performance. You can see the performance and then evaluate it, probably using some performance metrics. Okay, accuracy. You can get the precision, the recall, all of those ones. Okay, so I'm going all of those ones I'll mention because I have a case study that we're going to talk about. All right. So predictive analysis. It plays a very crucial role in early diagnosis. So we can diagnose when there's this person is going to have cancer. How do we know that or this person is going to have cancer based on the data that has been provided? Probably the personal data, the past medical data of this person, probably based on the health record of this person has been provided. Then we can now predict, oh, this person is going to have diabetes, this person is going to have cancer, so we are predicting. Okay, so that way patients would actually take caution, or maybe now we can prescribe, okay, to avoid this, you have to do this to avoid this kind of ailment in the next 5 years. You have to stop some lifestyles and then imbibe some other lifestyle. So that is why we actually perform predictive analysis, and we use various machine learning techniques. We have so many. Anyways, I just listed a few here. Logistic regression, which predicts the binary outcomes, like the likelihood of developing a disease. So based on some risk factors that has been identified. So logistic regression will actually predict the outcome, or we tell you, okay, this is the likelihood of developing a disease because of this particular, because of this particular risk factor that have been identified in your health system. Then we have decision tree. It breaks down the data, patient's data into different branches. So now when this happens, when patient's data has been broken down, it helps to identify the potential diagnosis. Okay, now the data has been broken down. Where exactly needs to be diagnosed? All right. Where exactly does the patient need help? Where exactly do we need to where exactly do we need to focus on to help this patient? All right. So it helps for that. Then we have, it's just like a tree. A tree has different branches. So when we say decision tree, it's the data is now being broken down into different branches, just the way a tree has various branches. And these branches, they have different number of leaves on the branches, right? So that is how decision tree works. Okay. Then random forest is an ensemble of decision trees that enhances accuracy. Then we have neural networks and support vector machine. Now, what is the benefit? Why is early disease prediction performed? Now, we have predictions like maybe health diseases or cancer disease or diabetes, which when they are being predicted early, it leads to better treatment outcome. So when a patient is at risk of probably developing cancer or maybe heart diseases, you can easily predict when there's an early disease prediction, then you can easily treat or prevent, or even if it will happen, you can still delay. It depends on what stage, let's say cancer, it depends on what stage it has gotten to. Right. But then when there's an early prediction, then there could be maybe medications or treatment or something that could be done to salvage the situation if it can still happen. All right. Then there's personalized treatment plans. Now, sometimes or a lot of times, there are patients that probably have a genetic issue, DNA. Right. So based on your DNA, there are some plans, treatment plans that may not work for you based on some underlying conditions that you have, there are some treatment plans that won't work for you. So now what happens? There's a personalized, customized treatment plan that's been customized by the doctor or by the medical practitioners to help your situation based on what your probably is. There's the kind of DNA cannot take some treatment plans, or maybe because of other ailments that you have, there are some that will not work for you. That is why sometimes when you go to the hospital and then you are being prescribed medication, the nurses or the pharmacists will ask you, do you have any, do you react to this medication? Do you react to any medication? When you say react, they want to check, okay, this particular medication, what's the components of the medication? Probably you will react to it or not. So based on your own kind of body system, the way it's being built, probably you will react to something. So they will prescribe another thing. All right. So timely identification of health risk. When diseases are being predicted early, medical practitioners are able to identify the health risk quickly. So that way they are able to prescribe treatment or solution. Okay. Then applications of predictive analysis. They are predicting health diseases, early detection, diabetes, and cancer detection. I don't want to spend much time on that. I already mentioned that. And there are various challenges also. Data quality. Okay. Then we have interpretability, which addressing the challenges of complex machine learning models. All right. And sometimes when when we try to address the challenge of some learning models, of complex learning models, then it is difficult for the health professionals to actually interpret based on maybe the model that have been used. So now it poses a challenge for whoever is trying to interpret. Maybe they will have to get someone that is an expert that will now help to interpret. Okay, then privacy and ethics, which I mentioned earlier on, then integrating with existing system. This challenge also I mentioned generally when I was talking about challenges that could happen when we're using machine learning for healthcare. Okay, so now another one is image recognition for medical imaging. Now, what do we mean by image recognition? This is using AI, using image recognition. Now we're using AI to analyze and interpret medical images. So you have CT scans where you have to place people under a machine and then it takes them in, scan all through their body, brings them out, or MRI, any kind of MRI, maybe prostate MRI or whatever it is, X-rays, all of these are medical images. So image recognition now it uses artificial intelligence algorithms or machine learning algorithms as we keep calling it, okay, to analyze and then it interprets. Before, when people are being analyzed, when I remembered years ago when I was entering into where I was about going to the high school, and then we were asked to do X-ray, and then they have to stand in front of a big machine. You have to stay there for some minutes to be able to take complete X-ray. But now there are systems. I remember recently, some months ago, I did an X-ray and then I just put my chest. Less than 10 seconds, I removed it, and then that was all. I didn't even spend up to just few seconds. I just put my chest and then, okay, now you can take your chest. I was surprised. Oh, so fast. Yeah, because it's more like it's just touching it and then it scans everything already. So unlike when you have to, I remember then years ago, you have to it's more like hugging the system and then pulling. They will ask you to, put your chest on it so tight to be able to capture everything. Yeah, but now it's way easier. So importance of image recognition, it plays a crucial role also in assisting healthcare professionals to get accurate diagnosis. And then images are being fed. Now we have images, right, that have been scanned, and then they are being fed into the algorithm. So the algorithm helps to analyze, it helps to identify if there are anomalies, if there are patterns that needs to be gotten, if there are different other features that need to be gotten. So this helps the medical professional to identify all of that, and that way they're able to interpret to the patient, and then they also get an understanding of how to prescribe any solution to help the patient. Okay, so applications of image recognition, we have it's being used in tumor detection, automatic diagnosis, okay, which helps to automatic diagnose diseases in people, in patients, organ segmentation. So image recognition tools now can actually segment and identify specific organs or structures. So now, in our body, we have various organs. So it can identify which organ has problem, even though, yeah, now you're performing CT scan to see all of your organs. That same CT scan will see if this organ has a problem. Okay, this one has maybe the arteries is actually blocked. The CT scan will tell you this part of the arteries. For example, we have the arteries, we have middle, left, and right, right? So CT scan, for example, we identify which one is blocked. Maybe this one is 100% blocked or 90% blocked. Another one is 30% blocked. This one is maybe 20% blocked. That is, what CT scan does. Okay, so with the help of artificial intelligence, it gives you even the percentage. Okay, the AI now is being used for that. So it makes it easier for doctors. They just put you through the CT scan, 15 minutes, you're out. 10 minutes, 15 minutes, you're out. It scans everything, it tells you where the problem is. Okay, so auto monitoring disease progression. So you can see did you're in stage one, patient with stage one cancer, stage two, stage three, you can monitor, and then for each stages, you can see what solution do we give. Oh, okay, maybe there's no solution that can bring permanent healing, but then how do we maintain this patient's health? So it helps to show progression. If the patient is decaying, it shows, okay, in the next few months, you're going to get to a particular stage where you might likely not survive, So all of this is being done. So challenges also for this limited data availability. And the reason why for this data is limited is because images are not always provided. So medical images are very vital, and then it's not always provided for except on exceptional cases where um, people's images, scans and all of that will be provided for analysis to be done. All right. So the data sets, even if you go online and then in online repositories where people get data set freely, the medical image data set are one kind that is not so common. All right. Yeah, it's not so common. So interoperability of deep learning model also is another issue. Like CNN is majorly used for image recognition, and then this CNN is called also a black box model. Why? Because it lacks transparency. So a lot of time people refer to CNN as a black box model. It's used for uh, image recognition, but then it also has that transparency problem. So that is one challenge that it poses as well. Then variability in the image quality. So depending on what machine you're using, the quality of the image might not allow you to get the the very accurate performance or accurate outcome. So now it depends on how good the image is. It's just like taking a picture with your phone. If someone takes a picture with a very good phone that has high pixel, and that one takes with a picture that has low pixel. Definitely, the quality of the images are going to be different. So let's go to personalized medicine. Now, what do we mean by personalized medicine? Okay, some people call it precision medicine. Okay, now personalized medicine utilizes genetic information to tailor medical treatments. So I made mention of it earlier on, probably because of your DNA or some genetic information that is peculiar to you, right? Or maybe to your family, then medications or treatments will be allocated to you, customized treatments. That's what we mean by personalized food. So you can have so many patients in the room and then they have different conditions. So definitely they will not be placed on the same kind of medications or the same kind of treatment. All right. Now maybe you're trying to diet, you're trying to go on diet for your health. But then because you have some underlying sicknesses, you have some things that will not allow that diet to work. So you now decide to get a diet instructor to prepare a personalized diet for you because you're trying to cut weight or you're trying to go on dieting plans, but then because of your health issues, the instructor or whoever is managing your health or your diet now would have to bring up a plan that is customized, that is personalized just for you because of your health. So that is simply what personalized medicine is. Okay, so it also allows for development of targeted therapies. So because of your health condition, your kind of what your DNA is, or what kind of health issues you have, you can have personalized therapies that will be made personalized for you. Okay. Now, what is the benefits? We have targeted treatment. It allows for treatment to be tailored to you, just for you. It doesn't mean it has to be across board. Okay, because you have some special cases, so it has to be tailored to you. Then enhanced drug development. So now this personalized medicine has also helped in developing targeted therapies in research now. Because when we see that, okay, people, for example, people that have, you have maybe diabetes, which is an underlying sickness, and then you want to be placed on a particular kind of treatment. But now the diabetes does not come only with other things. You have maybe high cholesterol, you have some other sicknesses, maybe you have HBP, so probably you have something that triggers HBP in you. So therapies will be targeted for you just to make sure that it caters for your health conditions. All right. So that way, researchers can actually research deeper and say, okay, people with this kind of ailment, this is what all over the world, this is what we can now prescribe, or these are the kind of drugs that we have to develop to take care of them. So someone that has maybe a combination of high cholesterol, that has also the diabetes, and then the person also has tendency of having high blood pressure, So now researchers can decide to go on research and find how to develop drug, medicine, okay, for such people. And then that can now take care of people that have that kind of ailments. All right. So we have cost effectiveness. So when we optimize treatment plans, it also helps. It costs in the healthcare costs. Okay, it reduces healthcare costs because now you don't have to start doing trial and error because you already know this person has this ailment. So you don't have to start treating something else. You just go directly for what can work for them. So it's cut cost, especially on the side of the patient. The patient tried this, or it doesn't work. Okay, let's try this. Oh, we discovered that this is not something that can work for you. Let's try this. So the patient has done different tests, different scans, wasting money. But then when there's a personalized medicine, when it's put in place, you already know this person's ailment, then just prescribe whatever works for the person. So it saves money. And then there are challenges, anyways, that comes with that also. Genetic variability. Because of we all have different generic makeup, so it poses challenge. Now imagine there are 20 people in the room, so everybody has different genetic makeup that makes health professionals to now try to get personalized, to personalize the treatment for everybody. So it will cost them a lot. It will take time, it will take money, energy and all of that. Yeah, even though it will be effective, but then that is one challenge now that some health professionals might find as something that they still can't handle yet. Okay, then data privacy and security, regulatory orders. A lot of times, all of these comes with complex regulatory bodies that you have to, all those and bodies that you have to satisfy. There are conditions, there are regulatory conditions that has to be satisfied before personalized medicine can be implemented. So all of this needs to be taken care of. Okay, and then integration of data from different sources also. Now, let's go to AI-driven drug discovery and development. Now, I'm trying to move fast because of our time. Yeah, so machine learning algorithm analyzes vast amount of biological and chemical data to identify potential drug candidates. So using machine learning, we can also, researchers now use it for drug discovery and development, okay, because it helps to when there's a vast amount of data, the chemical data, biological data, they are being analyzed, and now this gives a better understanding for health professionals, for people working in the research and development. They can develop drugs now that will help either for personalized medicine or for diagnosis or whatever they want to do. Okay, tools, techniques that can be used, and then predictive modeling. Yeah, so we have to use machine learning models to predict the efficacy of the drug that have been produced. Okay, so and it has its own challenges also. It's high cost, definitely. Developing a drug doesn't come cheap. It's very costly. And then lengthy timelines. Sometimes to develop a particular medication can take years, not just few months. It can take 5, 10, even 15 years to be able to successfully develop it and then be sure that it would work. And then another challenge is some of them come with low success rates. So you've tried, but then you see that it's still not working well. You go back to the drawing board, you start all over again. So until you're probably able to get a higher success rate. So you tried first, and then you see, okay, it's not working well the way it's supposed to do or the way you envisioned it. Then you go back again, go and put some components together, and then make it work. Okay, then we have regulatory orders. There are different regulations and requirements that need to be followed and fulfilled to implement drug development, and then complex biological statement. So now applications of machine learning in drug discovery. We have the drug repurposing. Machine learning algorithms actually helps to identify drugs that may be repurposed. That is drug that can be now used for other things. Okay, so we have a drug that has been purposely developed for this. But now there's an ailment whereby this drug can also be used for something else. A drug a drug can serve three different purposes or ill three different ailments. For example, now I'm creating a scenario. For example, you have a drug that maybe works for pain, right? It works for back pain or for pain generally. The same drug also helps for fever when you have high fever. Okay, that same drug also you can use it to actually after some time you discovered, oh, this drug also we can repurpose it and then it will redesign it so that probably we add a little more component and then is able to work for swollen legs or swollen hands or swollen body. Okay, so we can repurpose it. Machine learning algorithm helps with that. Okay, so you now discover maybe it's just a little component more we need to add that won't cost us much, and then it serves different purposes. Predictive modeling and then virtual screening. So these are the impacts of AI on drug development. which I've mentioned already. Then ethical consideration also. This is very important. Data privacy, biasness. This ethical consideration actually cuts across most of the applications of AI, okay, in healthcare. So I already mentioned this earlier on. Then now we have the hospital operations and resource management. How do we use machine learning or AI in hospital operations? We use it to optimize resource allocation. So now we can use artificial intelligence to see if we want to conduct a thorough analysis of resource utilization. So we can decide to review patient data, okay, admission rates. You want to see per week how many people do we actually admit that have this ailment? How many diabetic patients do we actually admit? How many cancer patients actually come for consultation? So that way, maybe based on the data that you've gathered over time, you can decide to do that survey for maybe 6 months to see, let's have a record, how many diabetes patients actually come to this hospital every week, okay? And then do that for 6 months. How many patients are having cancer or how many cancer patients have we diagnosed in the last 6 months? So why are they high? Why are they low? Why do we have to admit them? How many did we admit? So all of these are actually results. So it helps when you're trying to allocate rooms, for example. So you're trying to allocate rooms, okay, for this kind of patients, they are very low. We don't usually get this kind of patients. So the rooms that will be allocated or the beds that will be allocated to those people, we just make it minimal. Most people that come are maybe they are, let's say, influencer patients. Okay. Now COVID has gone down. Maybe in the era of COVID, it was more of COVID. So definitely, when we were in the era of COVID, people were having other ailments aside COVID. But then most hospitals focused on COVID patients because that was what was trending that time. So more beds were allocated for COVID patients, even though there are other people that have other things, other ailments that don't have COVID. So it helps in the resources allocation. Okay, staff, maybe nurses now have to be allocated to places where they have more patients. So every week or maybe every month, you have to put a schedule. Okay, 10 nurses per day. We have to attend to these people because they have high number of admissions. All of this, and then resources, infrastructures that are being used within the hospital. So it helps efficient staff management. So you're able to manage the use of staff within the health facility. So you can review performances of staff. You can train staff, cross-training staff members. Then if you need to do continuous training and development for staff also. So this actually helps. AI has helped in that. And then there are so many hospitals that even use robots to prescribe. So now there are places whereby after they've been diagnosed, robots will be the one to serve them the medication. The robot will communicate to them, tell them, okay, this you have to use it, and then one in the morning, one in the evening. So the robot walks or it goes into the room and then gives them their medication. So maybe such places, there are just few patients that robots can take care of, that can attend to them now. But when they need to do some other procedures, then doctors or nurses will come around. So it has helped also improving patient flows in hospitals. AI has also helped in that, streamlining admission process, bed management, like I mentioned earlier on, discharge planning. Okay, so after 2 days of treating this person, they need to be discharged. Then more people will come. So for each ailment, how long does it take them to be attended to and then discharged. Then we have what we call the remote patient monitoring. So I'm just going to run through this because of our time. Remote patient monitoring, because I have to create time for question and answer. So improved patient outcomes. Now, remote patient monitoring is something that is now going on a lot. Yeah. Okay. So telemedicine. I know our Philippine partners, the AI4PEP Philippines, are doing a lot in that aspect also in remote patient monitoring. And then we have enhancing patient engagement. So you can easily engage with patients. Okay. So when you are able to engage patients, the patient will feel involved, they will feel well taken care of, even though you cannot reach them personally, I mean, physically now, but then you can monitor their health remotely. You can see that instead of even traveling there, maybe you have to go there by boat or maybe there's no good transportation system. So it saves cost as well. You just have them on the other end, they consult with their doctor, maybe people in the villages now consult with doctors in the cities. Okay, so this also has helped a lot. Okay, those are part of the benefits. So efficient resource utilization and then remote access to care. So remote patient monitoring has also helped patients to have remote access to care. And then there are challenges that come with it. One is connectivity issues. Now imagine that you're trying to attend to patients in the village or places where they don't have good connectivity. So it will definitely hinder them from having access remotely to healthcare because of the connectivity. So data security concern also, this is another thing that has to be well taken care of. Then patient engagement, when patient also, some patients will prefer to see you in person than talking to them on phone or trying to monitor them, using some kind of devices. They will insist on seeing you in person. So that also could be a challenge. Now, what are the future directions of machine learning in healthcare? Integration of AI with robotic system. These are now being explored at the moment, and also, for future uh, researchers. Okay, implementation of smart health system, which really now is even ongoing. I have a research that is going on in this area, smart health system. The predictive role of ML in healthcare and advancement in remote health monitoring. This also is ongoing, but then there's still need for advancement. Now, let's briefly talk about the case study. Okay, so for example, there is this case study that I worked on, which is machine learning techniques for diabetes prediction. Okay, so and what exactly, I know we all know what diabetes is. So diabetes is a chronic life-threatening illness. Okay, that actually, if it is not detected on time, it can be deadly. Okay, if it's not detected on time, it can actually be deadly. And so it can lead to various complications like kidney failure, cardiovascular disease, and many more. So that is why the early prediction is very important. So we did a research on this, on machine learning, and then our aim was to determine the most effective machine learning method that was used for accurate prediction. So we got a data set, and then we tried to see which machine learning technique actually gives a most accurate prediction. So, and that also contributed to early intervention strategies and improving patient outcome. So, what exactly did you do? And how did you do it? We explored supervised machine learning techniques. So we actually made use of supervised. Earlier in the lecture, I talked about different types, supervised, unsupervised, reinforcement learning, and all of that. So we made use of supervised learning and then hybrid ensemble method that to predict diabetes. So our data was gotten from a 2015 behavioral risk factor surveillance system that was collected in America, okay, by the CDC. So that was the data set that was analyzed, that we got and then was analyzed. Now, these are the different machine learning techniques that we used, okay, for our study: NB, naive Bayes, KNN, SVM, and decision tree. And then we made use of assemble technique. So what exactly is this assemble technique? It helps. What assemble technique does, in short, is that it helps to improve performance of machine learning techniques. So it helps to improve, to cater for where there are weaknesses. So it boosts, it optimizes. So just in short, it optimizes the performance of a machine learning technique. So we made use of assemble technique, we made use of bagging and boosting. Okay, so and then we made use of bagging because it reduces variance. So by training many independent model, and also boosting reduces both variance and biases. All right, in the data. So our results now, after doing that, first of all, we made use of a base model performance, that is the KNN, the four that I mentioned earlier on, the KNN, DT, NB, and SVM. And these are the the accuracy, the precision, and then we have the recall. Now, those are different. We call those ones performance metrics. Okay, accuracy, precision, recall, F1 score. There are quite a number of them. So we call them the performance metrics that we use to, excuse me, that we actually use to evaluate our performance. All right. So we can see there that among the base models, KNN actually achieved the highest accuracy and precision, and then it's followed by DT. So while naive base having the lowest demonstrated the highest recall anyways. So, and because of that, it indicates its sensitivity to detect positive cases. So now from here, we can see which of these base models actually have the highest accuracy, especially. Now coming to assemble performance. Sorry, I made mention of it that assemble techniques actually is used to optimize, right? It helps to optimize uh, um, machine learning technique. So we make use of random forest, bagged KNN, bagged DT, NB, SVM. So from there, you can see that actually RF, that is random forest, achieved high accuracy of 91.9% and a precision also of 81.0%. So this superior performance, is expected. Why? Due to the inherent strength of RF as a bagging ensemble. So, and there is a bagging, RF is a bagging ensemble of decision trees that now has some what we call additional randomness, which is introduced at the feature level. So that is why the RF actually gives a better performance. So next to that is the bagged KNN. So, and then the bagged KNN also, it's performed very well. And then we have the bagged DT and NB and SVM. Then also we have another assemble technique, which is the boosting. So just like the name implies, the boosting also, it exhibits better performance. We have the GB, okay, gradient boosting, which emerges as the top performer, okay, and then that is also followed by the XGB, okay, and then we have the ADA boost and the SVM. So comparing to that, so we can see that we got now from our results, we actually got very good results. The accuracy for all of them, actually, especially the especially G boost, which actually gives the top performer out of all both the base model and the assemble model. Okay, now so collaboration between universities and industries in advancing healthcare. Now, a lot of times there are so many collaborations that goes on between industry and universities, okay, in advancing AI. So we have funding opportunities also that are happen that have been a lot of times it's been gotten from the industry to fund research in the universities. So quite a number of relationship between university research and industry research. And then lastly, we have ongoing global projects in the healthcare AI. I'm sure people that are part of the AI community are familiar with all of this. Okay, so there are quite a number. Now, I belong to the AI4PEP Malaysia, and then our research currently focuses on AI-enabled blockchain technology for healthcare. So we're collaborating with industry partners such as Survey Medical Center, where we're getting our data set from, and then also Ministry of Health in Malaysia. So we have funders who is IDRC in Canada. So we actually have quite a number of that. All right, so thank you very much. That is the end of my presentation. Okay, thank you.
Thank you so much for your amazing presentation, Dr. Samya. I definitely learned a lot, especially I appreciated the case study and seeing how all those technologies that you applied, that you described, can be implemented in a real world example. So we're gonna go straight into the Q&A period for the sake of time. So I saw one. Oh, Dr. Pearl, go ahead.
Yes, hello, good evening. Thank you, Samuel, for that nice talk. you're aware of the AI4PEP, the Atipan project in the Philippines, right? And
Yes.
for something as high tech as AI, how do you demonstrate informed consent from, say, IP communities? Because I must admit, I'm an applied mathematician retired from the university, and I hardly understand AI. And how do you, explain it to IPs anywhere in the world that to get them to agree to test your methods on them?
So I agree. Sorry, I didn't get the question well. How to agree to what? Sorry, I'm trying to
Yeah,
get that.
I wrote it in the
Understand?
chat. I wrote it in the chat. It's in the chat.
Oh, I can read it out if that's helpful. So the question is, how do you determine informed consent from, for example, indigenous peoples, especially from the perspective of not understanding AI, but more focused on mathematics? How can you ensure that unexposed people can give informed consent?
Oh, okay. Yeah, right. So, we can easily inform unexposed people or uninformed people about the role of AI. Now, we can decide to have some demonstrations for them to see. Now, for example, you're trying to promote remote health monitoring, and then some patients in
Right.
the yeah, in the remote places say, okay, because we do not have access to health, so we feel that we cannot get, we don't have access to health in the city, so we feel that we cannot get good health care from the government or from whatever agency. But then now we can demonstrate to them, okay, while we are in the city, we just need you to make use of those devices, connect to us, either on audio or video or a particular system. Now, another thing that some actually do is in those remote places, they have some local health centers. So even
Mhm.
where there is, which has been built, okay? So now when those people maybe lack of connectivity from the patient side and the remote areas, they go to those specialized health centers, and those health centers connects with the people in the city. So we need to explain. Yeah, I know explain to them can take some time for them to understand, but then demonstrating when they see it, they will be wowed that, oh, really? So this thing exists, this thing can work. Saying it by mouth will be difficult, but then seeing it being practicalized now is something that they would actually buy. And then when they see that it has worked for this, and we have evidence, when we have evidence, oh, it's worked for this, it's worked for this person. Okay, you see, when you're in the city, and then now you're in the village or in the remote areas, we are in the city, we can easily attend to you, and they do it for the first person, second person. They themselves will be the one to promote it in those remote areas and say, oh, these things really works. So a lot of times I know where ignorance will make people not want to agree, but then
Right.
when they have demonstrated models, that is now we have to demonstrate to them, see how it works, see how it has worked, see what it's doing in some other communities. That will help to also convince them and better inform them of how AI can help them. I don't know if that helps.
Thank you.
Thank you so much for that question and that excellent answer. We also have a question from Prof. Dixon Nsaga.
Thank you so much, Mr. Ajibade, for that presentation. So I have a concern. The first thing is that AI is a new technology, and there are a lot of ethical issues as well as misconceptions. Did you face challenges in carrying out the work that are linked to ethics in Malaysia? Misconceptions? Are laws already been enacted in Malaysia that takes care of AI in healthcare delivery? Thank you.
Now in terms of ethical issues, now on our side now I made mention of it that we have a project going on whereby we're getting our data from Surrey Medical Center. Now the first time we approached, I mean Surrey Medical Center, part of their staff also did that part of the AI for PP team in Malaysia, and so I remember sometime last year that I went to, I had a meeting with them at Soil Medical Center, and then to get for our data set, right? We were trying to get an influencer data set and COVID data set. So, and then, they made us understand that, okay, before anything like that can be done, they have to go through some ethical, take care of some ethical measures. Okay, so on their own end, also they have some things that they need to do, some procedures that need to be performed. So people get data, but then as long as you are able to go through the ethical or whatever regulatory or whatever body that governs that data, then it is possible. Now, that took them some months. I mean, in some medical center now, that took them some months to do all of that. And eventually it was gotten. Now we're on the stage whereby we're trying to get now a research assistant that will actually go there and help us categorize all those data because it has successfully gone through that ethical process. So for every country, it differs. Okay, for some, it's a seamless process. For some, maybe you have to go through some authorities, some authorities, some authorities. Okay, so here, so to get that done, the Soil Medical Center handle that they have every system. Somewhere university, for example, they have their, if there's anything like that, they have ethical, data like that, they have ethical team that takes care of anything that has to do with ethics. So Soil Medical also has their own team that they have to take care of anything that has to do with ethics. So when all of those ones are being sorted and successfully sorted out, then data can be released. Do you get
Thank
that?
you.
So
Yeah,
yeah,
thank
so
you.
for different countries it differs. Whatever happens in different countries actually differs. So for maybe your country, I might not be able to say how it works there, but then now in Malaysia where I am and what we have done so far, that is what happened. Okay.
Thank you.
Does that answer your question, please?
Yes, it answered my question. I wanted to also know whether there are any laws in Malaysia that governs AI in healthcare delivery.
Laws in Malaysia that govern AI in delivering healthcare. Per se, there are no laws. One thing about AI is you said something that AI is new, right? So every institution, every government is trying to still come up with appropriate rules or regulations that can take care of AI. Even the university, for example, some university where we are right now, the management is trying to come up with appropriate regulations to take care of maybe plagiarism, AI, use of AI to write assignments, projects and all of that. And so many universities, not just in Malaysia, even in the US and UK, so many universities are still trying to get the appropriate regulation, and governments also try to get appropriate regulation. So you see something because AI is still in the developing stage in so many countries. The countries are just starting to explore what AI is all about. Even in Malaysia, now there are so many people looking for AI experts. I have a friend that works in the media industry, and then he was telling me some months ago that right now his company is looking for AI expert because the AI now is a new area that people are beginning to look into. So there's no let's say 100% established regulations that's taking care of that yet, because they also have to study the use of this AI to see if there's will be a very stringent regulation that will be put in place or will be put down to take care of all of that. Okay,
Thank you. Thank you.
you're
Thank
welcome.
you.
Thank you. We also have a question from Thomas Kanga, if you want to unmute. If not, I can read it from the chat. I think I received a DM. So the question was, as a health tech startup, how do we collaborate with AI stakeholders in scaling innovation, especially within AI4PEP's network? Like as an external startup, how can we collaborate?
Oh, as external, right? The
Yeah.
question says
Yeah.
as external, right?
Yes.
That
So
wants to collaborate with AI for PP.
yes.
Okay. I think that one will better be answered by Dr. Emmanuel. right? For how to go about collaboration.
Yeah,
So maybe
thank you. Thank you, Professor Samuel. Thomas, it depends on which country you are located. You are in Ghana, I think. So we have two AI for PEP projects running in Ghana, and they're doing amazing projects. You can reach out to me. I'll leave my email and we can connect you with the investigators, the principal investigators, and you can actually uh, collaborate with them within the country. So, as AI for PEP, we work with diverse stakeholders, including the private sector. So, I'll be happy to connect you. I'll leave my email address in the chat, and you can email me and I'll connect you with the PI in Ghana or the PIs in Ghana. And you can reach out to them.
Amazing. Thank you, Dr. Musa. And
I
then,
have a question
yeah,
also
go ahead.
for Professor Samuel.
okay,
Can I go on,
please.
Taylor?
Yes,
Yes,
please.
go ahead. Thank you.
Very good. One concern, especially in the healthcare sector now, is that there's the fear that AI will soon replace the health workforce to a large extent. In a study that was done recently, very interesting study that was done recently in King's College London, uh, and a number of other sites in the UK, showed that AI diagnosis, for medical imaging, was found to be remarkably uh, more accurate, or it outperformed radiologists by 94% accuracy. And given that type of scenario, it means that very soon we are probably not going to need radiologists, because before now, these are the people, after you do the imaging, you take the reports to them to interpret. And if machines are doing it better, these are highly paid professionals. It means that very soon you're probably not going to need them. So there's that fear. I just want to know your thoughts. There are many other examples within the health sector where we think you gave several examples of application of machine learning in different aspects of the health system. Uh, so there's that fear that the health workforce may be replaced as we go on. So what are your thoughts on this? I'd like to know your thoughts. Thank you.
Okay, thank you. I've actually gotten this kind of question so many times, even from my students, like saying, okay, will AI replace our future in the job, our jobs in the future, and all of that. Right now, AI, my opinion, AI has come to help. So for me, I see AI as an helper. Yeah, you're right in that study that says that when for medical imaging, AI seems to be able to diagnose, and then getting 90 something percent accuracy. Yeah, and that way it doesn't mean that people will be out of job. Yeah, to be sincere, a few. But then one thing that I usually tell people, and I do tell my students even in class when they ask such question is, now is the time to even see AI as a tool that helps you to work and think smarter. So we as Iman, we in the past we've had a way of doing things. So now with the and then nobody ever knew that AI would ever come and want to take their jobs. So with the help of AI now, it helps us to better reorientate ourselves. That okay, if AI can do this, then another job role can be provided. Now, when AI is being implemented, there's still someone that will trigger the work. So that person is still there. There will still be a radiologist that will be needed to trigger the work of AI. So even though there will be people there to control it, so AI will just do the work now, do the diagnosis and all of that. But then there are still people that will be consulted. So those radiologists are still needed, even though now sincerely the numbers might drop. In a case where you have 10 radiologists, maybe at the long run it will now be 2 or 3 that will eventually be needed to also implement the use of AI, because behind every AI was designed by, I mean, it's human that's controlling it. So definitely the human contribution will still be needed, even though now the contribution might be reduced, the workforce might be reduced, which sincerely it would. In fact, it happened already here in Malaysia, where there's this company that laid off, or they, yeah, let me call it laid off. They let go of some staff because they felt, okay, you guys are working as just what do you call it, front desk, whatever, front desk officers, but now we have an automated system that helps people, so laid them off, right? So unfortunately, it happened. I think that was last year. Unfortunately, it happened. But then at the same time, it was now making people to wake up that, okay, since this area now is seeing AI is beginning to take it, then I would rather go in this particular area or get more specialized, more skills. Now, one thing that someone did, I read on LinkedIn that he did was, when he discovered in his company that they were about to be laid off, sometimes you get to know maybe that, okay, a few months before, a few weeks before. So what he did was that he decided to dig deeper. Okay, what is it that, and they were being laid off because of AI, right? Because AI was trying to take the management was trying to implement AI, and then, okay, whatever you're doing, which is just being out there, AI can do it better. So he decided to upskill, and so after he was laid off, few months after, he was re-employed for another role to now manage the AI. Why? It took his time to upskill. And then the same company employed him back that, oh, now we need you. Before they told him they didn't need him. Now they needed him because that opened his mind. I think the human mind is, the human mind is wide, just that we use a little of it, of our capacity, what we can do. So that helped him to open up his mind that, okay, I think I can do this better. So why not upskill and then get the skill? And so I agree with you, AI will take out some jobs, but then at the same time, AI has come to also help and to help us work smarter. So I'll put it that way. Okay. Thank you.
Thank you for that. I kind of have a follow-up question actually about related to the transition period of if there's, like you mentioned that, let's say if there's 10 radiologists and maybe it could drop to 3. For the 7 that remain, what do you think is like a good ethical way to support like a transition of work? Like if, let's say, you were one of the 7, like are you saying that upskilling is the best way, the best path for making sure that even though we need to use this technology is very valuable, we also want to make sure that the human resources that are being affected have a pathway, but can still use the skill set that they've accumulated. So I don't know, what are your thoughts?
Sorry, I didn't get your question well, but now saying upskill, I'm not saying that upskill is the solution to avoiding that. I was just giving a scenario, okay? That's okay. What someone posted, what I read on LinkedIn, okay, that someone posted about that happened to his own personal experience, right? So, if I get you right, you're trying to be clear on that, right?
Yes,
That's
just clarification.
sorry.
Just clarification, yeah.
Okay, on the upskilling,
Yeah.
if it's a solution.
Yes, as a solution.
Yeah, it is not the main solution. It's just one thing. Why I mentioned that is, okay, when this person discovered that they are being laid off, they were doing it little by little, and then he knew his turn was going to come. So he decided to upskill. And then again, he was eventually laid off months after he was reemployed to manage the same AI. So I made mention of something earlier on. AI is being implemented as a system, but then there are still human that will control the AI, that are in charge of it. Okay, robot is serving. For example, robot is serving food in the restaurant, right? But then if robot breaks down, some people will fix it. Some people will have to, okay, program, do this robot go to table 5, serve them this, and this. There are still people that are still controlling it. So what is that robot is doing is, instead of human beings carrying the tray and plates to the table. Now robots will go serve them, while the people now having to control the robot are just behind, maybe in the room there or something, or in the kitchen, or something. Even though now the people that won't be needed there anymore will be the servers, but there will still be people that will have to control the AI or the robots now in this case. Okay, so now when people are not being needed anymore, that was what I said, the case that I read on LinkedIn. This person wasn't needed anymore. He looked for another thing that he would be needed in, and then he decided to upskill in that area. But that doesn't mean, probably, yeah, upskilling also would help. At least I learned from what he did, because it opened up his mind that he has this capacity and this capability to do something better for himself. And then he decided to go for something that the company would need him for, which is now having skills to manage that AI, that machine. It's just a machine that's being used. So, but there will be people to manage it. So, and this also now will open up. Now there are so many people. There are so many AI engineers. Before there was nothing like that. So AI has opened up more job roles. There are people now that work as AI engineers. There are people now that work as prompt engineers. It was never there. So I know I have a friend. I was telling him that, oh, he wants to work as he was planning here. He was training to work as a data analyst, but then all of a sudden he had interest in becoming a prompt engineer, and then he went into it. He gave it full force. Now he's been employed in the US as a prompt engineer. Because he believed, okay, if I decide to work as a data analyst, but then maybe very soon the market will be saturated or something, or but then now he decided to go into prompt engineering, which he trained himself, he got the skills, and now he works as a prompt engineer. So it's opened up more doors. AI opened up more job opportunities. So it's just for we human now to explore what opportunities are available so that we'll still be relevant. So that is what I actually mean.
Thank you. That was a great answer. So we'll just take one last quick question and then wrap up. In the chat from EDC, okay, it says, how can AI be integrated in the study of infectious disease?
Okay, how can AI be integrated in study of infectious diseases? Now, we can, I made mention of prediction analysis, right? So AI can be used in predicting diseases that are infectious. And before you can predict that, or before you can read that, you make use of some data, some, like I call it, historical data, right? So based on past data, you can see if this disease is infectious or not. Because in the past, it has happened. Maybe people that have this kind of, they have some risk, maybe they have a low immune system, they easily get infectious by some kind of diseases. So now you can diagnose patient, okay, this patient, because you have this kind of immune system or you have this kind of ailment, so if you're at risk of getting infected by this particular disease or by this list of diseases. So AI models helps to predict, so it can be easily integrated, okay, in the study of infectious disease. All you just need to do is know, okay, you have the right data. And so having the right data means now you can easily now predict, because you're going to perform some predictive analysis. So you can easily now predict, okay, what disease is infectious, and then how can you prevent such people from being infected. Okay, when we're talking about analysis now, we have what we call descriptive analysis. Though I didn't mention of all of this anyways, because it's not, I'm just digressing a bit. We have what we call descriptive analysis. We have what we call predictive analysis, and then we have what we call prescriptive analysis. So, okay, so you describe a particular problem, then you predict, you can predict, okay, because you are living this kind of lifestyle, you're going to have this ailment in the future. So now, based on that, because of the data that the patient already have, you can prescribe a solution. Okay, you can prescribe a solution that will maybe heal the ailment or reduce the risk at which the person can be infected or something like that. Yeah, so all of that can be explored.
Okay, thank you so much. Thank you so much for that answer. And thank you again for your amazing presentation and for engaging so well with us in the discussion, and thank you to our audience also for giving such strong questions. So we're gonna wrap up right there, but thank you everyone for joining us. And you can connect with AI4PEP through the QR code on the screen or through the socials shared in the bottom left corner of the screen. So thank you so much, everyone, and I hope you have a great day or rest of your day.
Thank you very much.
Hi, everyone. Thank you so much for the
Thank
amazing
you.
presentation. Bye. Thank you. Thank you,
Bye.
everyone. Thank you so much.
Thank you.
Thank you.